It's general consensus on what the healthy value or what a normal value is. Generally, the figure is around 120, 80, and the upper limit's usually 140, 140 and 90. It can go just a little bit higher, but generally, your doctor, your local GP will monitor it and give you advice. Okay. It's all dependent on your health. Blood pressure reflects, or it is a component of your cardiovascular health. Generally, healthier populations or healthier people would normally have a lower blood pressure. And if the higher blood pressure will sort of indicate some form of disease process that's going on, especially in obesity, or say, some people have a family history of high blood pressure. Stress can raise your blood pressure, even exercise as well.
Okay, excellent. So in regards to a client with high blood pressure, explain contraindications to exercises in relation to the condition. So are there any contraindicated exercises in related to the condition?
So if a client has isolated high blood pressure alone, I understand that high blood pressure is a risk factor for developing ischemic heart disease such as heart attacks. So if they haven't had any heart attacks, it usually is not many contraindications to clients. What we want to do is, again, if it's too high, I would usually measure blood pressure before and after the workout. And I don't want to push the client into too intense exercises as that can raise the blood pressure even more. So I don't think there are much contraindications. As usual, we'll do cardio, we'll do strength training. As always, if there's any chest pain, I think just stop from there. And always hit a RPE of about 7,
Okay,
in my opinion.
excellent. And what are some appropriate modifications based on this condition? So how would you modify things for a client with high blood pressure?
Okay. So I would start off with light exercises and slowly increase to moderate intensity exercises. I think that clients with high blood pressure can usually begin to tolerate quite good moderate intensity exercises. I won't hit high intensity just yet.
Okay, so now we're going into a client with lower back pain. What is your understanding of the lower back pain condition?
So my understanding of lower back pain it's often divided into muscular or skeletal. It can be a problem with the spine or the joint itself in your spine. It's mostly often lower back, referring to the lumbar area. It can also be due to tight muscles or really weak muscles in your back, core muscles that are sort of supporting your spine. Generally, back pain, it can be muscular pain again, like I said, or it can be joint pain. So people who have herniated discs or with disc prolapse can develop nerve type of pain. So stemming from your back, they often radiate down to your lower limbs.
Okay.
But now it's just, so I think it's just muscular versus joint back pain.
All right. What are some contraindications to exercise in relation to lower back pain?
And then again, like I said, if the problem is muscular, I think generally if there are any pain, I like to go low intensity. The contraindications are going full-on compound exercises such as like deadlifts or full-on squats with weights on it. Not to say that you cannot do this, I would just like to do them without any weights. Again, I'll focus on form just to make sure everything's correct, and especially I would use any back braces, for example, equipment to help reinforce the back and relieve the tension of the muscles. And again, if it's muscular back pain, I think we can work towards strengthening the weaker muscles. But if the problem is stemming from disc prolapse, I think that has to be limited and with further advice from a local doctor or GP as to what limitations that we can do.
Okay, excellent. Suggestions for appropriate modifications based on this condition. You pretty much explained that, but is there anything else that you want to add to that?
So I would like to start with isolated strength training. Anything from using machines that isolates your body. Instead of doing a squat for legs, I would just do leg extensions or assisted leg presses. I think that would be much more useful or helpful for back pain.
Okay, excellent. A client with an injury, with knee injury. Okay, so you've got a client with a knee injury. show your understanding of what a knee injury actually is. What is the condition and what is it?
Okay, so knee injury can result from many things. A knee injury can result from damage to the ligaments in your knee itself. Any trauma, such as direct trauma, can result in inflammation of the soft tissue. Bursitis is one of them. So with this knee injury, my understanding is obviously components of either soft tissue, the joint problem, or the ligamentous problem itself. I think.
Okay, all right. And yeah, that's. How would you explain contraindications to the exercises related to the condition?
With knee injury?
Yes, with knee injury.
Yep. So generally with knee injury, I would like to again start off with non-impact workouts. So
Yes.
with cardio, I tend to pick cycling, cross-training as
Yes.
well, and then we'll sort of see how much the client can tolerate.
Yeah.
Obviously with proper medical clearance,
Yeah.
and then go from there.
Okay, and suggest some appropriate modifications based on this particular condition.
Again, I like to do isolated training first. With cardio, obviously do the non-impact ones, and then with strength, do isolated strengthening of the muscles. Again, with the weights, I will go light intensity on the weights, especially because, and I would obviously like to use knee straps if possible, just to reinforce and protect the